Hello again, Changemakers. Welcome back to the Ballard Center's video series on tackling social problems. In our last two episodes, we introduced our mantra, do good better, and explained what it means to love the problem. Today, we're diving into the principles of human-centered design to create and test your social problem-solving idea. This involves using the groundwork you did loving the problem, and then making it come to life through rapid prototyping, iteration, measurement, evaluation, and pivoting. These are powerful tools used by social impact organizations, policymakers, and community leaders to address complex social challenges.
These principles offer a way to develop and test social impact ideas, sometimes called interventions. Let's think of the process as if you were a social impact scientist. You need to approach the issue with an experimental mindset. This means embracing the uncertainty, being open to trying different solutions, and not being scared to get your hands dirty.
Research shows that an experimental approach is the best way to solve problems. One study asked teams of MBA students to compete against teams of kindergartners to see who could build the tallest freestanding structure using spaghetti, tape, string, and a marshmallow. It turned out that the MBA students did worse than the kindergartners, because while the MBAs focused on planning the perfect model, the kindergartners jumped right in, experimenting and failing, learning from each version. It was all their testing that helped them build taller, sturdier spaghetti towers. The MBAs failed by focusing on finding a single right plan that didn't actually work when they built it. This study highlighted the value of using an experimental approach, like the problem-solving mindset of the kindergartners.
So, how do you start experimenting? You first need to create a hypothesis, or a tentative solution for a social problem. You then test that intervention in iterations, small, repeatable experiments. You measure the result of those experiments and then evaluate how well your prototype performed. Then you repeat the process until you've developed the solution that fits the problem.
To do that, we'll look at a real-world problem that our friends at Neonatal Rescue are working on right now, providing access to healthcare training and low-cost ventilators to decrease newborn mortality rates in developing countries.
First, let's talk about rapid prototyping. Prototyping is all about testing ideas before they're fully implemented. It's like outlining a paper before you write it. We want to make a scaled-down version of our solution to see how it works in the real world. We ask ourselves, how can I do this simply and quickly to get immediate feedback? Prototyping helps us keep our mistakes small and less expensive.
Consider our example problem, access to ventilators in the developing world. We want to introduce you to one of our friends, Rob Brown, the CEO of Neonatal Rescue, a nonprofit organization dedicated to reducing infant mortality in low-resource regions of the world. Here's what he had to say about the prototyping process Neonatal had to go through before finalizing their intervention.
At a very low cost, we actually went to Sprinkler World and Home Depot and put together a working prototype of this device. And I'd say that's step one, is kind of that proof of concept phase, taking the idea and putting it into reality where you say, hey, look, this is actually something that works and is feasible just based on that idea.
This prototyping phase is all about learning and adapting. It helps us better understand the specific needs and preferences of others, getting feedback to identify what works and what doesn't.
And by uncovering these insights early on, we can iterate on our solution before we invest too much time and resources into a full-scale implementation. This approach minimizes risks and maximizes the potential for success.
Next, let's dive right into the principle of iteration. Imagine you're trying to bake the perfect chocolate chip cookie. You try a recipe, but the cookies turn out too hard. What do? You tweak the recipe, maybe by adding more butter or by baking them for a shorter time, and try again. That's the process of iteration. You make a change, test it out, and keep refining until you get the results that you're looking for.
Exactly. And when we're working with social problems, iteration is crucial because these problems are often multifaceted.
But implementing a solution like this isn't a one-and-done kind of deal. It's a process of ongoing refinement. Let's go back to Rob.
We took the first year to go out, build the prototype, and then actually take that and show it to the stakeholders and say, hey, what do you think of this? What would you do differently? We were able to build 3 or 4 different iterations of that initial concept. We were changing the knob or we were changing the gauge just based on the feedback that we got. And ours is obviously also very linked to the protocol that a doctor uses to treat somebody. And so there is a lot of learning and understanding that we had to do there.
The key takeaway here is that iteration isn't about failure. It's about continuous improvement. It's about being adaptable, flexible, and open to change. We're always seeking ways to make our interventions more effective, more impactful, and more responsive to the unique needs and challenges of the communities we're serving.
Now, let's move to the principle of measurement. This is where we ask ourselves, is our solution making a difference? Measurement is all about assessing the impact of our intervention.
To measure our impact effectively, we need to start with clear, measurable goals. Here's what Rob had to say about setting goals.
Our goal was to save infants' lives in low resource environments.
To track progress towards these goals, we need to identify outcomes. These are specific, measurable metrics that show us how well our solution is working.
Obviously, you want to measure your impact. So in our case, we look at that piece and we say, how many lives have we saved? And then we actually can run dollars per life saved, which is a super huge number because we can place a ventilator for $2,500 that may save 100 lives. And so that's only $25 per one life saved. And then we have other metrics like how many people have we trained? How many ventilators have we placed? And those are secondary.
Notice that we're not only measuring outputs, like the number of ventilators deployed. A measure like that doesn't tell us enough about how people's lives are changed because of our intervention. Instead of just measuring how much we did, we should measure the results of what we did. There are a variety of ways to measure outcomes. For something like ventilators, we might use patient surveys, health data, or community feedback. With tools like these, we can see if our intervention is achieving its goals and make adjustments to continuously improve our solution.
That is the beauty of measurement. It's a continuous process that allows us to make data-driven decisions. We're not just relying on our gut instincts or on our hopes for our intervention. We're using real, concrete data to see what's working and what's not, and to make informed decisions about how to continue iterating and improving.
Let's dive into our next principle, evaluation. Evaluation is all about assessing the overall success of our intervention, giving us a clear picture of how well it has worked and where there may be room for improvement.
For example, we could evaluate a set period, maybe 6 months or a year. We'd look at our outcomes, analyze the data that we've collected, and assess the overall impact of our intervention in the target community. We would also look at any unintended consequences or challenges that emerged during the implementation.
It's so important for us to remember, though, that evaluation isn't just about numbers. It's also about listening to the experiences of those directly impacted by our efforts. We might conduct interviews or focus groups with patients, healthcare providers, and local community members to gather their insights and feedback.
The ultimate goal of evaluation is to help us make better plans. We use the insights from our evaluation to refine our solution and guide our next steps. This might lead to scaling our intervention to other communities or making adjustments to the work that we're already doing. It might even mean stopping because our efforts aren't moving the needle, or worse, they're backfiring.
No solution is perfect. Even with the best intentions and a thoughtful approach, there may still be unforeseen challenges. Being adaptable and open to feedback is essential for navigating these barriers.
This is where the idea of pivoting comes into play. Pivoting involves making changes to the intervention based on the feedback and data gathered during the evaluation phase. This could include changing features, adjusting the target audience, or even changing the overall direction of the intervention. It's an adaptive response to our ever-evolving understanding of the needs of those that we're trying to help. Successful changemakers embrace the idea of pivoting, recognizing that it's not a sign of failure, but instead simply a way to help us become better at doing good.
And that brings us to the end of our video on testing your idea using the principles of prototyping, iteration, measurement, evaluation, and pivoting. Remember that addressing social problems is a complex and ongoing process. It requires continuous learning, adaptation, and collaboration. Whether you're working on healthcare disparities, poverty, or any other social issue, these principles can be a valuable guide in your efforts to make a positive impact.
We've covered a lot of ground in this video series, all the way from defining our problem to evaluating our solution. Thank you for joining us in this journey, and we encourage you to keep exploring, keep iterating, and keep making a difference in the world. And as you do so, you can not only do good, but do good better.
If you found this video helpful, be sure to hit the like button and subscribe to our channel for more insights on making a positive social impact. And don't forget to share this video with your friends, colleagues, and fellow changemakers. Let's spread the knowledge and empower more people to make a difference.
Thank you for being a part of this journey, and we look forward to seeing the positive change you create in the world.